Hello, everyone. I'm a first-year student. My name is Autumn Little. I'm from the University of North Carolina, Charlotte. I'm a pre-nursing major with a focus in gynecology. And my presentation is on technology in the healthcare setting. My research problem was the pros and cons that come with excessive amounts of technology in healthcare settings, including hospitals, nursing homes, and databases. My abstract. This research entails examining technology as a fast-growing system in the United States, specifically in healthcare settings. The purpose is to analyze and elaborate on how technology is affecting patients and workers as a unit and the environment. I've done this by examining statistics on the amount of personal technology in the healthcare setting, the average amount of deaths associated with health-acquired infections, and the overall amount of people that are visiting hospitals a year, while comparing them with evidence from articles and journals on how technology is affecting this. Purpose, again, is to analyze and elaborate on how technology is affecting patients and workers as a unit. So my question is technology hurting and killing the patients or contributing to better results medically and physically? I assume the environment is directly interrelated to technology. The complexity of science is concerned with the unpredictable and dynamic dimensions that technology may bring to the future. And another assumption would be that patient care comes first before everything else. Data. In the United States, about 85% of hospitals allow clinicians and staff to connect their personal devices to the hospitals and Wi-Fi's. So that includes your nurses, your doctors, and just your patients and residents that are coming in. In 2013 alone, 7,095,145 patient records were impacted by data breaches, and 22% of these breaches were caused by unauthorized access. So a lot of people think, well, this doesn't affect me, my information has been breached, but taxpayers are the ones who do pay to get hospitals and all their information back and secured. So it affects all of us. The estimated annual cost of data breachings to the healthcare industry is roughly about $5.6 billion, and that comes out of taxpayer dollars, as well as costs that come from hospitals, nursing homes that the breachings have occurred in. A year, there are about 136.3 million emergency department visits in American hospitals. Hospital-acquired infections cause 1.7 million infections per year and are associated with approximately 100,000 deaths. So that's coming from our nurses and doctors bringing different infections from room to room, not washing their hands properly, especially with technology. Now there are a lot of tablets being used. There are a lot of the rowing machines being used from room to room. And if it's not being cleaned properly, a lot of things are being spread from patient to patient. I argue technology is a key fragment to pushing our society into the future if used with apprehension and caution. A few available solutions to cutting down technical deficiencies are regulating social media in the workplace, establishing hygiene routines with cellular devices and handheld laptops, and ensuring that prior permission is obtained before taking photos and videos at work. As a CNA, I work at a nursing home, and we're taught always to wash our hands constantly. We're always told to keep our stethophones clean. Everything's always supposed to be clean, but we're not told to keep our laptops and iPads clean and to keep them clean from room to room. So with that, a lot of different infections can be spread from patient to patient, especially in nursing homes where a lot of people are dying, and little infections can really make a big difference. Why is this important? New technical devices and procedures are being introduced into the healthcare setting every day. Fundamental etiquettes that display specific rules and regulations should be introduced quickly to all healthcare professionals. So hospitals and databases should put out things that are saying specific rules of when things should be cleaned. Every night there should be a staff member who cleans all of the technology from room to room, change out what you're using, different laptops, different tablets to take information. And as far as breachings go, we need more secure systems. Future direction of research. A future direction would be to specifically dedicate time to composing programs and lessons on protecting patients and residents from infection control. And those are my references. And this is an ongoing study also as technology keeps being introduced. Any questions?
Has there been much research on this topic?
Not much. From what I've seen, there was a little bit of research on diseases being spread from person to person and hospitals, doctors to their patients, but not much on the technology side of it, of like people cleaning their laptops, people cleaning their iPads, because that is something that now instead of using clipboards and pens and things like that to keep information, people are now using that. So.
I think it's also really interesting that you bring this up with relation to iPads and mobile devices and things like that, because a lot of the devices that do have those clear cleaning regimens, those are regulated, especially by the manufacturer, for how those are supposed to be handled and cleaned in a clinical setting consistently. But when you start introducing these new devices that maybe that's not their first suggested use, that's the role, how to adapt and change and implement those new regulations.
Yeah. People are definitely forgetting that, yes, it's important to clean your hands. Yes, it's important for us to change our pens and our pencils from room to room, but people are forgetting that our laptops, our phones carry so many infections and things. We're actually told to clean our phones every day with a disinfectant wipe. So if you're going room to room with people who are seriously ill, it's really easy to cause infections. That's it.
So I'm involved in a project that collects data on water sanitation. And as part of that, we also collect data on healthcare facilities. This is not in the US, this is low and middle income countries. And so as part of that research, I also read about, so basically this was hand washing. So we're looking at the hand and soap and things like that, basic infrastructure. And as part of that, I also looked at a lot of papers that talk about how physicians and people who work in the healthcare facility, so let's call them healthcare workers, doctors, nurses, allied staff, they are especially bad at maintaining hand hygiene. So that's a universal fact, and it was like stated as a fact in one of the articles. So it's not like me making up, but then they said based on all the evidence, it's injected especially bad. So given that background, so you mentioned that you're being told to wash hands, but it looks like not everybody's washing hands,
Yes.
right? So let's take that as a fact. How do you make sure that you are able to follow a regimen where one of the recommendations was using handheld devices for training, but then you're also suggesting that it's usually limited or at least monitored in some ways that things are kept clean. Do you have a plan or a way that you can collect data on maybe samples or microbiota samples from those devices to figure out if there is any infection that's being carried out, which allows you to more strongly suggest that these are actions that need to be mitigated, rather than saying, okay, we think that there is something happening, and so we are proposing something, although we don't know what's happening.
Well, for sure, hand washing is something that people aren't doing as well, which is why when doctors and nurses are going in for their boards, that is a specific thing that we have to do. You have to demonstrate how to wash your hands properly, and people still aren't, for some reason, able to figure out how to do it well. So with technology being introduced to the system, I think a way to really track and be able to go into hospitals, and when people are coming out of their rooms, doctors and nurses, maybe swabbing their technical devices to see what is being tracked from one room to another. So as one of my things that I said that we should do would be to like have stands outside of rooms. So when we walk out of a patient's room, there's always a sanitizer stand for our hands. But now that technology is being introduced now, I think that it shouldn't just be for your hands. You should have a disinfectant area for laptops, for computers, for tablets. you're told to leave your pen inside of the room so you're not bringing any germs from one room to another. Maybe having a tablet for each room. Yes, that's a lot of cost, but when you see how many people are actually dying from hospital-acquired infections, I think it would actually be really good. Yes.
Yeah, I don't know if you know, like, the percentage or, like, likelihood, I guess, like, the percentage of people dying from, like, contracting something in a hospital.
Yes, I do, actually. It was on here. 1 second. 1.7 million infections per year are associated with approximately 100,000 deaths, and that's just in hospitals. So that's not including nursing homes and out-of-home places like that. These are just hospitals by themselves.
Is it US data?
Is this one?
I mean, is it only in the United States? Or
Yes, this is just in the United States by itself. So in other countries, it may be even higher. That's it.
I
Yes.
also have a small clarification question. When you say technologies, do you mean technical devices or like something broader?
Really focusing on technical devices. So instead of using paper and pen now, people are using tablets and laptops to keep information on each patient, each resident, instead of writing things down. So that was really the focus. You're welcome. That's it.
Start with a new phone, and you see the Okay, I was just talking while you were getting ready, that's all, so.
Right.
Yeah, I think that's how I decided, and that's really a great idea.
Because I think more the audiences, maybe the general public, the way you framed it, that we are paying for it, but I think the decisions that are being made by hospital administrators who need to be convinced that this is costing them and their reputation and their
It's a brand on that one.
yeah.
Because it looks really bad and all of these people are dying from hospital fires. Like, this isn't even like I'm coming in and I'm sick. This is specifically I'm in the hospital and someone's bringing a germ to me and that's how I'm getting people sick. So.
That's really cool. I like it. Well, it's lovely having to follow all of you. So thanks for that. But my name is Katie Cason, and I am going to be speaking with you today on the impact of hormonal regulation in the gut on nutritional treatment of anxiety in college students. So as you can imagine and have probably experienced firsthand, there's plenty of anxiety involved in giving presentations like this one right now, and also as being a college student in general. However, you can see that is not a big enough deterrent to stop all of these people from going to college. So the rate of enrollment, total enrollment in the United States has grown significantly. And although it did decrease slightly in 2014 and 2015, college enrollment is projected to increase all the way to 23,135,000 by the year 2024. So it's definitely growing. At the same time, the Association for University and College Counseling Center Directors, they have reported a rise in their annual journals in anxiety as the presenting concern for treatment at their counseling services. Since 2010, anxiety has been the most prevalent issue reported, so it actually has surpassed depression, and it accounted for 47.3% of counseling services in 2015 through this board. And the Association for University and College Counseling Center Directors is it's an agreement between many different universities and colleges, and it is actually an international service as well. So this is hundreds of thousands of students being reported. So the growing number of college students enrolled and seeking treatment for anxiety, there's a need to better understand and treat this. So the problem here is, how do we effectively treat anxiety in these students? The efficacy of these treatments could lie in the incorporation of a holistic view of the complex relationships between the gut, the brain, and hormonal regulation.
and especially in response to stress. I'll begin by discussing these relationships and their application to anxiety, and then examine some variables that play into that. They may be pre-existing, and there's also ones that are environmental once they arrive at school. And they can be exacerbated with the college experience. And then we'll look at treatment methods that have been effective and how they are interrelated and can lead to more innovative treatments. So some basic assumptions are that gut health and hormonal regulation are involved, that there is a mind-gut-brain relationship that occurs, and that there are a lot of different variables that go into play that can affect all of those regions and relationships. And showing that a holistic approach and perspective is needed to treat this anxiety, including a nutritional-based treatment plan, is important because you can't look at things just in a one-dimensional fashion. So it's important to recognize the gut as brain relationship. There is it's a multi-directional signaling system between the brain and the gut. So research is showing that the microbiota gut-brain axis is influential because the gut and brain are in constant communication. And the colonization of the microbiota of the gut is actually playing into the responses through the hypothalamus pituitary adrenal axis feedback loop. So you've got a constant multi-directional relationship and communication effort here that's responding to stress, it's responding to hormones that are produced while also trying to regulate those hormonal responses. And what's interesting is that all of this is actually changing. So there are multiple studies showing that the dysregulation of the HPA axis feedback loop is a result of as a result of trauma can have lasting effects. And then that HPA axis dysregulation has been linked to anxiety as an effect that has been lasting. So some of the existing variables and factors of the dysregulation and of the composition include care in infancy. So studies have shown that when introduced to stressful stimuli early in life, the HPA axis dysregulation can begin. So the regulation can go off. So you're talking repression, suppression of these hormonal responses. And that can lead to lasting effects later in life, not just immediately. So you're seeing these things that happen in infancy still impact you in adulthood. And this is especially studies in mice. So the maternal parent here is supposed to be, having these petting sessions and providing this care and this touch. And if the mice do not receive this, then they are constantly deficient of this external soothing. It's very much into the, the cry it out method and how much is too much there, which is a tricky balance. As far as parental stress, that can also impact it because there are also studies done on the hereditary nature of this. For example, in populations where there have been famine and stress, the second generation from that can skew to one side and become obese. So you have the initial population that suffers from this famine and they're malnourished and their children are malnourished, and then the second generation tends to be obese. So it's interesting to see how that factors in. Now, as far as the specific microbiota of the gut, the colonization was previously thought to begin at birth. So they thought that was something that, you start having these seeds planted at birth. But what they're finding now is that it is actually occurring in utero and changes through infancy with transference through breastfeeding infants versus formula feeding. Nutrition is also in play because children, especially, fiber or the lack thereof is integral in making sure that they have the proper gut microbiota. The introduction of antibiotics is also interesting. There's another study in mice that has found that the absence of, well, the effect of antibiotics leading to the absence and decrease of certain colonies in the gut is leaving those mice more susceptible to metabolic disorders. Finally, environmental factors can play a role in changing that microbiota through contact. So in childhood, this looks like, do children go to daycare? How many siblings do they have? And in college, you're going to find that, you have a host of new experiences. So not only do you take childhood trauma, antibiotic use, but you also have changes to your environment with the introduction of dorms, roommates, students, new buildings. You have dietary changes. You may have heard of the freshman 15. Well, studies in mice showed a significant increase in anxiety and microbiota changes when they were fed a high-fat diet. But there's also a rumor that college students can survive on ramen noodles. Well, processed and boxed foods really they cause a lack of fiber in foods and nutritional content as they're moved. So looking at the Western diet and how the gut flora is changed is also really important. And there is research obviously showing how all of these are integrated and interrelated, which means that there's room for improvement here. So treatment opportunities and further research. I'm not proposing that nutrition alone is going to solve anxiety in college students. There are still finals and presentations and things like that. It's a complex issue, but there is more research that's needed. I feel like there's a lot of research that's needed. Obviously, I've talked a lot about mice in this presentation, so there's a need for more studies, more human studies, to especially establish the long-term significance of early trauma on the HPA axis. It's also worth noting that in the high-fat diet study, they actually were studying two things. They were studying the effects of high-fat diets and also the effects of exercise on the mice. And so they found, it was interesting because they found that in the high-fat diet, the mice had increased anxiety, and the exercise did not counteract that. And, in counseling services and things to deal with anxiety, you usually have some pretty basic questions. Do you exercise? Do you eat right? Things like that. And so I think it was interesting to see that that the exercise did not reduce anxiety levels. However, it actually did increase their cognition. So they had improved cognition with exercise. They had higher anxiety with a high-fat diet, but the exercise did not counteract the anxiety. This serves to show that anxiety diagnoses of humans, it involves more than just statistics or a psychological approach. It calls for an understanding of humans as intricate biopsychosocial systems. And there are signs that microbiota therapy is a viable treatment. While this may not be at the top of every college student's list of things to do, fecal transplants have proven very effective at changing and regulating the gut flora, and nutritional changes. Yeah, it's exactly what you think it is. Nope, it's exactly what you think it is. But it's proven very, very effective.
Okay, let me just be really clear.
It's a poop transplant. It's a poop transplant.
So they'll have someone that has an ideal system?
They'll take fecal matter that is properly colonized with the balance that you want, okay?
The ideal one.
And then they introduce that into the body and allow it, to cultivate. And they've been able to reverse the dysregulation through those.
That procedure is something quick and easy, or is that something?
They do it pretty regularly in offices.
Okay, so it's
Yeah.
not uncommon.
It's not uncommon. It's
Nobody talks
maybe not talked about frequently.
today.
Until today. Why not? So obviously we've got fecal transplants, and then nutritional changes such as increasing fiber, decreasing processed foods that just strip nutrients or give false nutrients, I should say, is also a way to positively influence the gut. The use of probiotics, either by ingested food or food supplements, has also shown promise in changing and balancing this microbiota, because what you're looking for is not just one or the other. What you're looking for is the ideal conditions within that environment. So why does changing the microbiota matter? It matters because they have shown that changing it and getting the right balance can actually reverse long-term dysregulation. So you start having an improved and correct hormonal response to stress. And especially, in some studies, they had completely germ-free mice that were having these awful responses. And by introducing the proper colonization, they were able to elicit the appropriate hormonal response. So if these, if implementing simple things like nutritional changes and probiotics can have such an impact and can actually, be an effective tool, then it's worth looking into. And as I've learned more about the reach of nutrition within this, multifaceted biopsychosocial, environmental, lived body, if you will, experience, and that could just be the philosophy student in me as well, find that I'm led to continue research of this, especially in the areas of looking at us as humans in mind and thinking that matters, that we matter. And the way that I mean that is that you have a lot of policies, public health initiatives, things like that, that really focus on the food industry and how it affects them and how it affects the industry itself versus how it affects us. And so I think that protecting ourselves and what we're eating and what we're exposed to is also really important. Looking at expanded nutritional guidelines to see how those go into play, and public health initiatives that incorporate not just the typical questions, let's say on a counseling intake form would be, do you feel like you eat pretty well? Do you eat breakfast? Do you eat enough? Do you feel guilty about what you eat? None of those actually say, okay, well, are you getting your vitamins? It's just very surface level. Do you have an eating disorder or not? And this is talking about potential for disordered eating, but also implementing and correcting eating versus then just a lack or binge. So ultimately, I'm interested in looking at integrating nutrition as part of a care plan in college wellness centers, and through that having the ability to perform more research, in an actual clinical setting. And this is a real picture from me of a vending machine on campus with Southern biscuits and gravy flavored potato chips. Not pictured, but beside them, I have the full picture, but I thought that was just very nice. You also had, to the right, fried flamin' hot Cheetos. And then in the 2 rows below were barbecue pork rinds, salt and vinegar potato chips, several varieties of sandwich crackers, packages of Oreos, and bottles of 5 Hour Energy. So that, this is not a full view of the dining options offered at the University of North Carolina at Charlotte. However, I think it's important because I see students, my peers every day, who go for the most convenient and cheap food that's right there in between breaks. And I cannot attest to the full nutritional content of Southern gravy and biscuits potato chips, but it could be great for you. But I would probably take my 230 calories elsewhere. And it definitely provides a view where there's area for improvement. Yes.
So if there's a nutritional benefit to alleviate anxiety,
Mm-hmm.
could you also make a case that nutrition could anxiety is a preliminary.
Absolutely. So, anxiety is my focus simply because it's risen. It's the most prevalent that's being reported at this time. So the idea of anxiety here is not just people who are diagnosed with generalized anxiety disorder. This is self-reporting. This is, what the students are seeking help with. So I think that the HPA axis, there is research. Anxiety, depression, 95% of your serotonin is produced in the gut. And this also, all of this is about cortisol release and production and regulation. So depression and other psychological issues in that line are very interrelated. So I think that looking at this is going to provide treatment options for a host of mental health concerns.